Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Dwayne Cooper with Carolina Donor Services. Dwayne will speak with us about organ donations. And next we'll talk with Angie Fisher, the Director of Clinical Improvement at Novant Health Brunswick Medical Center. Angie will be here to talk to us about advanced directives and National Healthcare Decisions Day. Finally, we have Dee Lewis, who will share her personal experience at Novant Health Brunswick Medical Center. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dwayne Cooper, Community Relations Coordinator with Carolina Donor Services. Well, welcome to the show today, Dwayne. It's such a pleasure to have you.
Thank you. I appreciate you guys inviting me on.
Absolutely. Well, we're here today to talk about Carolina Donor Services. So where are you located? Are you like all over the state?
Actually, we are. We have 3 offices. We have one in Greenville, North Carolina, one in Durham, and one in Winston-Salem, North Carolina. So.
Well, good. And what is your role at Carolina Donor Services?
I'm the Community Relations Coordinator, and what that means is I'm the one that does the public information stuff. I do community events. I do public awareness, community education. So I do those sort of things for the community, and I cover Eastern North Carolina. So. I'm out doing a lot of educating, dispelling myths and those sort of things that circle around organ and tissue donation. So that's what I do. Well,
that's kind of what we want to do here today. We want to dispel myths and we want to encourage people to sign up. So first of all, tell me how to sign up as an organ donor.
Well, there's 3 ways you can sign up. You can register online at DonateLifeNC/register. Also, when you go to the DMV to renew your license or get an ID card, you can ask to have a red heart put in your license, which the symbol means in North Carolina that you're an organ and eye donor. And also, you can sign up through a paper enrollment form, and you can request that form by just calling our office at 1-800-200-2672.
Now, I know there's some misunderstandings about what tissues or what organs can be donated. Let's talk about that a little bit.
We have 8 organs that we can recover for donation. We have the lungs, we count as 2. We have the kidneys, we count as 2.
Wow.
We have the pancreas, the liver, the heart, and the small intestines. As far as the tissues we can recover for a transplant, we have the corneas, which is the thin seeding over the iris, over the eyes. We have bone, we have skin, we have tendons, we have veins. We also have heart valves that we can recover. So there's a lot of tissues that we can recover as well.
Well, that is a lot of stuff.
Yeah.
And it's great that with the 2 kidneys and the 2 lungs, you get twice your...
so to speak, right? You can save 4 people, so that's wonderful, So yes, absolutely.
So when we recover all of those things, how do they get distributed? How does that work?
Well, that's through a network called UNOS, and UNOS is an acronym for United Network of Organ Sharing. And what happens is we have a potential donor. Their information is placed into the UNOS database, the size of the organ. We're looking at a lot of different donor criteria, the blood type, that sort of thing. On the patient end, we're looking for the recipient end. We're looking at some criteria for them. Once the system has a match, UNOS will print out what we call a match run list. And everyone that's a perfect match for the donor's organ would appear on that list. And then we begin to call the transplant centers to offer them this particular organ for their patient.
So I have the heart on my driver's license. I am an organ donor. So if something should happen to me, then all my information is dumped into that
into the UNOS database, right. Your donor criteria is entered into the UNOS database. And then again, all the persons that are waiting for transplant that would best match your donor criteria would appear, their names would appear on that match run list. And they would, their transplant centers would receive calls from the organ donor coordinators saying that we have a potential match for your recipient.
Well, that sounds like a very coordinated process.
Absolutely, yes, it is.
When I think that some folks are a little bit concerned that you take their organs too soon, like, when is that decision made and how is that decision
Right.
made?
They sort of think, we're going to let you die. And that's not true.
Absolutely not true. I
Again,
know
doctors they're taking every measure they can to save your life.
Right.
This is their job. And, and it's no point in letting you pass away because to be a donor, because you may not match anybody on the transplant waiting list.
Exactly.
We may find, we run various serology tests and stuff, may find some disease you didn't know you had at the time.
Right.
That would prevent you from being an organ donor. So that's it's a myth, and those are two reasons why something like that would not happen. But again, the thing is, doctors are taking a Hippocratic oath to save your life, and every measure is going to be done to save your life.
Yeah, and then once your time has ended, then you give somebody else a chance
Right.
At a decent or a
Right.
good and healthy life.
Right.
So that's really good. Now, we talked a little bit about tissue donation and organs. How long are they viable? Is that a...
Different organs have a different amount of time
Sure.
for preservation. The heart has the least amount of time, 4 to 6 hours that it needs to be
Really?
recovered in place. The kidneys, 24 hours without a kidney pump, up to 72 hours on a kidney pump. As far as the tissues are viable for transplants anywhere from 2 weeks to several years.
Wow, that's
for
great.
tissue. So again, but the organs really do have the shorter lifespan outside the body. They need to be recovered in place as quickly as possible.
Mm-hmm. So being an organ donor
Mm-hmm.
myself, I say take everything in all. Do you have to stipulate that, or do you...
Well, with the heart on your license, where the difference comes in is if we have a heart on your license consent for all organs and eyes. If you want to be specific about what you donate, that decision can be made online at the Donate Life NC/register, where you can indicate heart and lungs,
Gotcha.
just my eyes, that sort of thing. So there are some people that are specific and want to specifically donate specific things, and you can do that online, yes.
Okay. Wrapping up here, if you had
Mm-hmm.
one thing you wanted to get across, what would that be? I assume it's educate your family.
Right, absolutely. We encourage everyone to share their wishes with their family that if that time comes that they would like to be an organ donor. And we need for people to also understand that you have the power to give the gift of life. You can save 8 people through donation, enhance the lives of 50 more with all the different uses of tissue.
Those are great statistics.
Thank you.
Well, thank you so much for being here, Dwayne. It's been a pleasure to have you, and I would love for you to come back. I know there's lots more for you to tell me about.
Oh, absolutely there is, and I thank you for having me on.
You're quite welcome. Now we'll speak with Angie Fisher, Director of Clinical Improvement at Novant Health Brunswick Medical Center. Well, welcome back to the show, Angie. It's such a pleasure to have you.
Thank you. I'm glad to be here.
Great. Let's talk a little bit about your role as the Director of Clinical Improvement at Novant Health Brunswick Medical Center.
I really get to do a variety of things in that role. I work a lot with government agencies, but in that role I'm also work with discharge planning, and that's where my involvement in advanced directives comes in. So it's a very varied position, but it's exciting.
Well, we're glad to have you here today, Angie, and specifically we wanted to talk about advanced directives and something called National Healthcare Decisions Day. So first of all, tell me what an advanced directive is.
An advanced directive is the decision that you make along with your family and friends about what you want to have happen to you when you're in an end-of-life situation. Sometimes it's planned for, sometimes it's not. But it's really about making those directions in advance. That's what it's all about.
Oh, in advance. So it kind of...
Advanced directive.
Yeah.
Exactly.
Okay. So what is this, what's the purpose of National Healthcare Decisions Day?
Well, National Healthcare Decision Day is a time that we've set aside to remind the public and those in healthcare about the importance of advanced directives. We want to encourage patients and families, have the conversation, talk about what it is that you want. and for us in healthcare to remind us to honor those advance directives wherever we possibly can.
Now, I know it's during the month of April. Is there a specific day?
April 16th.
April 16th. And will there be things on public TV and things like that to
Yes.
remind folks of
Yes,
of
things
that
just
day?
like this program. There'll be public service announcements. Again, reminding folks to have the conversation. It's something we often don't think about
That's true.
discussing.
Well, people don't really want to talk about
Exactly.
death or
It's,
dying.
it's not a fun thing.
No, it isn't.
But it's important. Very important.
Yeah. Well, I've heard other terms used, such as power of attorney and also living will. Are those terms related to advance directives? Are they one and the same? Help me understand that.
They're related. An advance directive is some way of communicating. So a healthcare power of attorney may be the way that you choose a person that you know knows what you want. So that would be a healthcare power of attorney. You can work with your attorney and get that person designated. And it's in writing that you can show to the hospital if, Lord forbid, something happened to you. Someone can step up and say, I am Angie's healthcare power of attorney, and I know what she wants. A living will is the same thing, but in a document. So I've put in writing what I want if I should ever be in a terminal state. So it's one's kind of appointing a person, the other's putting it in a document.
So
but
I
they're
could
both
write
advance
my
directives.
own wishes. I could write those
Absolutely.
down in a document
Absolutely.
and have it in a safe place, and then that would be a living
That would be a form of a living will.
will.
Yes.
The power of attorney, do you have to have an attorney actually draw up the power of attorney?
It's better to have it, I guess, notarized.
I see.
But it kind of helps you make sure you've covered all the bases.
Right.
But it's different than the durable power of attorney for your financial and legal matters. So that's why it's important.
Oh, I understand. I'm glad you cleared that up, because I was thinking they were like all the same, but definitely not.
Definitely not.
Definitely not. So how would you decide which procedures that you would want or you would not want to prolong your life, and then which document would those appear in?
Well, it's almost impossible to guess everything that could ever happen.
Sure.
You're going to think about terminal illness, cancer, things like that. A lot of times now people think about dementing illnesses,
Yes.
and then brain damage. So there's a lot of different ways that one could end up at that end of life. The kinds of treatments you would think about, obviously there's CPR, chest compressions, there's ventilator, mechanical ventilation.
I always think about that.
Right. Those things you think about, but there's other things too, like artificial nutrition, artificial hydration, feeding tubes, IVs. And then even sometimes folks go so far as to think about, I don't want dialysis, or I don't want antibiotics. So it can be pretty extensive, and it's really about what matters to you. So that's why it's, again, so important to have that conversation and then appoint a person or put it in writing.
It seems like it would be a difficult task to come up with those things, and you might want to have somebody to discuss those with.
Absolutely. I would encourage people to talk to their physician, maybe even their minister, but just kind of think about the what if. And the best thing in the world is just to talk about it, really and truly.
Yeah. Well, on another aspect, if you're in a coma or you're mentally incompetent, who makes the decision then to stop treatment? Is it based on those documents?
Well, if there are documents, yes, absolutely, and that's what we want is documents. That's what this is all about. But if we don't, then it's going to be left up to your family or a physician or friends. That's why, I mean, if no other reason, think about them. It would be so much easier for them if you've told them, hey, I know what Angie wants, and so.
What would I do if I were in a position where there is no advance directive? What would the hospital do? They would talk to my family? Or?
Well, we will talk to the family. We would talk to the people that are close to you. There are informed consent laws in North Carolina.
Okay.
We're going to look for those documents preferably, or a healthcare power of attorney. If we don't have those, then the hospital has an ethics committee that can work with you if you're able, or with your family. And we're going to help you figure out what's important to you, or to your family, maybe make suggestions, but those would be the resources we would look to.
Well, that's really good information, Angie. And I'm curious, are there resources at Novant Health Brunswick Medical Center for patients and families to learn more about advanced directives?
Absolutely. We have an outstanding case management department. They can work with folks, not just those in the hospital, but we'll help out folks that are in the community if they reach out to us. We have documents. There's things provided by the state of North Carolina that can help you walk through preparing those documents. And then all you have to do is get it notarized. Mm-hmm. So yes, we have a lot of great resources.
Mm-hmm. I noticed each and every time I come in to the facility to have outpatient testing or what have you, I'm always asked, do you have a medical power of attorney or do you have a living will? So they're very good about prompting you to have those things in place. And I always say, no. and
well,
I always
we can hook you up.
And I always say to myself, gee, I probably need to do that, because you just never know.
We don't know.
Never know.
We really don't.
Well, Angie, it's been wonderful having you here today, and it was great information. I hope that all the folks out there listening will take heed and come up with those documents, because, again, it seems sort of a chore to leave it to your family to make those decisions when nobody knows what you want except you. So
that's exactly right.
It's a great thing, and I would encourage everyone to do that, including myself. So. All
right, and we'll help.
Well, thanks again, Angie, for being here. We really appreciate it and hope to see you soon.
All right, thank you.
You're welcome. Our last guest is Dee Lewis, who is here to share her story as she recently went through the death and dying experience with her mother at Novant Health Brunswick Medical Center. Well, welcome to the show today, Dee. It's such a pleasure to have you here.
Well, thank you.
Well, on today's show, we've already discussed organ donation, as well as end-of-life decisions and the National Healthcare Decisions Day. Mm-hmm. And so today I thought it would be important for you to be our guest and to share your story about how you recently accompanied your mother through that death and dying experience at Novant Health Brunswick Medical Center. Okay. So are you ready to get started?
I am.
Well, good. Well, let's kind of start at the beginning.
Okay.
When did your mother come to Novant Health Brunswick Medical Center?
This was on Monday, January 20th. Mm-hmm. She had a sudden illness and was brought to the hospital via ambulance and through her family physician. And then she was directly admitted into the emergency room. Of course, we had to, as a family, we had to go to the emergency room first.
Right.
And very pleasant experience there. The people at the desk were very helpful. They assured us that they were getting our mother to a room, and they would let us know as soon as that happened. We probably waited about 20 minutes or so, and then had to go up to the desk, of course, and fill out paperwork and things. Mm-hmm. And once all of that was completed, the little lady at the desk offered to take us through the hospital, wanted to make sure we knew where we were going.
Well, it can be kind of hard. It's a big place.
That's right.
You've never been there before.
Right, and of course we had never come in from that direction anyway. Mm-hmm. So yeah, she was very helpful. So she took us on up to the floor where my mother was, and they already had her in there, and she was resting comfortably. They were able to get her stabilized, her condition at that point. The hospitalist that was on staff that day was Dr. Adams, and he was just terrific. Came in, did a whole history with her and with us, and so that was all good. And then he explained to us that he wanted to do a referral to a GI specialist, because he felt like that was very important
Right.
to do that. So then, there was a period of waiting and, in order for the specialist to come in. And so we just stayed there with our mother. The nursing staff was phenomenal. I said to my brother at the time, I said, I've never been treated like this at a hospital before, that they just bent over backwards. They wanted to know what our names were. And, that was just really super. Plus the rooms are not like regular hospital rooms.
No, they're not.
They're very comfortable, and they explained to us where the refreshments were. If we needed.
Oh, that was nice.
Yeah, if we needed anything like that, and so that was on Monday, and then on Tuesday, then the specialist came in, which was Dr. Holt.
Frank Holt.
Yes, very nice man. He knew my mother's family physician very well, as did Dr. Adams.
Of course.
So we had a consultation with them.
Oh, well, that was nice.
It was very nice. So then Dr. Holt decided at that point that we would go ahead and schedule an upper GI to see what was going on. Obviously, she was having a GI bleed. And so that was all discussed. My mother understood, what was going on and, and all that. So then after they left, we had a visit from the chaplain.
Oh, that's nice. Yeah, we have a very great group of chaplains there that volunteer their time.
Right. That's what he said, and it was really interesting because he had a similar experience several years back when the hospital was at the old location. So then he shared all of that with us, and we had a nice little prayer and all with my mother, and so that was nice. But I think she really,
I bet,
just made her feel much more comfortable and everything. So then Wednesday morning, she was scheduled for her procedure. I arrived at the hospital extremely early, so I could spend some time with her before they took her down. We just thought this was going to be a routine test. Nurses came up and got her. The ladies that work with Dr. Holt, they were just so nice.
The employees at the hospital who provide support for him, yes.
Right, and from the operating room, and so they came in and they were just so sweet to my mother, and she's 88 years old, and so they understood about her instability, about standing up.
Sure.
I mean, they were just right there, and of course they let me just come right with them. Went down the back elevators, and then we got into the operating area, and then we went into a little room, and then the doctor and the anesthesiologist came in, and his name escapes me, the anesthesiologist. He was so nice. I mean, just explaining every little thing that was going to happen.
That's wonderful.
It was really great. So again, we just thought this was going to be a routine procedure. Off they go with her, and then in the meantime, one of the volunteers came by, asked me if I needed anything, if I needed coffee,
they're great.
They are. And she said, I'll keep an eye on things. I'll let you know what's going on.
Right.
And she came by a couple more times after that. Even, and so then,
did you get a blanket? Usually they're passing out blankets.
She asked me because it was that was that really cold snap that we had, and all the ice and everything. Asked me if I needed a blanket, and I told her no, I was fine. And so she told me how to operate the TV, and all that. So we sat there, and I watched the TV. And so then the anesthesiologist came out and explained to me that things weren't going as well as what they thought, that the bleeding had increased, and they were just very concerned. Well, at that point, of course, I was there by myself. He said, if you have any other family members, you might want to write. Yeah. So, and I knew it was very strange because the week before, my brother had this whole conversation with my mother about her end-of-life wishes, and she wasn't sick.
No.
So, and she told him exactly what she wanted done. She did have a living will in place, which was
That's
very
wonderful.
important. But I think it's just so important to have that verbal conversation because then there's no confusion about who wants what. So anyway, then I called my brother. He then
came
he
in?
came right away. And we explained to the doctor and to the anesthesiologist that my mother wanted a natural death.
Right.
We did not want any extra things to prolong. We just wanted her to be kept comfortable, no pain. So they totally agreed. In fact, I think they were relieved.
They were relieved that you
Yes,
knew that, and
yes.
you were able to communicate that to
So
them.
they said, well, that was exactly what they had in mind, and of course they wanted to do what we wanted.
Of course.
You know, if there was anything else, then that was fine. So, and we were just all kind of, you know, in shock at that point.
Of course.
You know, trying to
It's
get
a difficult
right.
time.
It was very difficult. So we stayed there and waited until they brought her out. And usually they take them to the recovery room from a procedure like that, and then the family can't go back there.
Correct.
Well, one of the nurses came out, and she was so worried, and she knew. You know,
She
what
knew
was
what was
happening.
going on.
She said,
Yeah.
I want you to come back here and be with your mother, you know, for as long as you can. And we were just kind of flabbergasted, you know, by the reaction from the whole staff. The volunteer came back by, you know, just to make sure that we were kind of headed in the right direction. So off we went. We asked to speak to Dr. Adams again. So they were going to arrange all of that. So they took us back to be with our mother, and she was aware you know, of us being there. They had given her some medication for pain, and we were waiting for an ICU room.
Oh, I see.
Yeah, they were going to go ahead and take her up there, so we would be more comfortable with her, and you know, and if anybody else needed to come to you know, to be with her. So we were probably in the recovery area for, I don't know, 30 to 45 minutes. They got a room ready, took us on up there, had us in a waiting room just for a little bit until they got
got her settled.
situated. Right.
Sure.
So we were able to call her minister from the church that
that's-
she'd been a member of for
That's
years.
great. Yeah.
Right, so he was able to get there. Then they took us on back into the room with her. She still was very aware of us being there.
Really?
And and then Dr. Adams came in then, and we talked with him again, and he was totally.
And he's the hospitalist.
Yes,
there.
that's correct. And he was totally on board with what was going on. That we
Right.
just wanted to keep her comfortable and just let.
That's just a wonderful story. And then she expired in ICU.
She did. The minister came. We were able to, to talk with her. She knew that he was there, and probably within about 30 minutes after he arrived, then she just, and it was the most peaceful thing, that I've ever seen. She just went.
She just went.
Yeah.
But with all the love and support of her family,
Right.
as well as the staff at the hospital,
Right.
They all played a part in that.
They did.
And
They
I'm
really
so
did.
happy to have you here, to have folks
Thank you.
hear about your story. You're so brave to come and talk about that, and you have our deepest sympathy
Thank you.
on the loss of your mother.
Thank you.
And I can't tell you how much I appreciate you sharing that story, because I think it's important for folks out there, especially during this month. It's organ procurement
Right.
month. I just think it's a real important story. So, Dee, thank you so much as a friend and as
Thank you. You're very welcome.
as a professional who works with you on several occasions. I just want you to know how much I appreciate you being here. You did a great job.
Thank you. You're very welcome. I appreciate the opportunity, to share my story with other people.
Well, it was a pleasure having you here today. And again, our deepest sympathies
Thank you.
for
Thank
your
you.
loss.
Thank you.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, local health care providers, and general health information, please visit novanthealth.org. Thanks again for joining us today, and be sure to join us next time for Health Watch on ATMC TV.